Good evening. The topic I was given to talk today is healthy diet for the nations from films of fantasy into reality. So I want to show two pictures before starting my talk. What are the thoughts crossing your mind when you see these pictures? Okay, some of you may identify these two giants in the field of nutrition and endocrinology. One is in Jaffna market, another one at the Colombo market. Right? Can you see the food variety, availability, and preference in these two places? Different places, even within our country, have different type of food based on culture, availability, and mostly because of the preference. Therefore, if we are to suggest a diet for our people in our nation, we need to understand the underlying science of food preference of our people. So, why do people choose one food over another? It is considerable matter to think and rethink before we prescribe a diet. There are several factors influencing acceptance of food. Biological factors, economical factors such as cost and income, physical determinants such as time and access, social factors such as culture, family, psychological determinants such as mood and attitude, etc. But most important determinant among all of the above are the biological factors, which are hunger, appetite, and taste. So, appetite, hunger, and taste are very important in eating behavior of a person. The systemic review done by Alice et al. In 2022 discussed involvement of homeostatic, non-homeostatic, and gut microbes in these three components. So, according to the review, food intake of hunger of human is controlled by hormonal mechanism as shown in this picture. If you see here, orexigenic hormone and neurotransmitters as shown in green, and anorexigenic hormones and neurotransmitters illustrated in pink. According to the result, it's very important to note that in the metabolic conditions such as obesity and diabetes, this hormonal regulation is altered and override by the non-homeostatic pathway. Therefore, it is very important to understand the non-homeostatic pathway in controlling hunger, appetite, and taste before recommending a diet to a person or nation, especially to lose weight and to gain a better control of blood sugar level. So let us see what is non-homeostatic pathway. So, what is the non-homeostatic pathway? It is also called hedonic feed, which is meant in Greek pleasure eating. This mainly depends on the food taste, odor, texture, and appearance. This pathway is controlled by a reward system which was developed mainly during the hunter-gathering era to eat more and more food and store for survival in a challenging environment with less food. But unfortunately, even in a food-rich environment like today, hedonic feeding persists within us, leading to overeating of our preferred food. This is the reason why people always in search of their comfort food. In this hedonic feed pathway, dopamine is the common and major driver for the food and drugs reward in the mesolimbic system. The reward system encodes three psychological components: wanting, liking, and learning. So wanting is the first phase of the hedonic field. The appetitive phase, it's called also the appetitive phase. The phase is related to obtain a reward. Hence, it's induced to acquire a nutrient. Wanting phase always choose calorie-dense food compared to others. That is why when people follow a non-carb diet or low-carb diet, for some time, they get the urge to eat high-cal, high-carb diet again and again. So next is second phase, the consumable phase or liking. When we start eating the food we like, liking phase get activated. If we have not eaten that food earlier, we have no liking to it. But once we started eating the food and started liking it, the pleasure gained from eating is amalgamated with the taste. Hence, people tend to choose food they like. So, if we want to behavior change in a food intake of a person, we have to consider their liking as well. Withholding or taking away every food people want and like will be challenge for sustainable effect. So last is the learning phase, where we learn the association between liking food and the pleasure generated by the eating it. Just like Pavlov's experiment with dogs and foods. You all know this experiment and how the dog got conditioned for the stimulus. It is the same for human. Therefore, people always seek their comfort food, no matter how hard we try to twist their type of food in optimizing the glycemic control, weight, etc. So, if we want to change a person's food behavior, we have to address earlier mentioned hedonic pathway. We might think it is all in our mind and it's psychological. But now it is well known that our gut microbiota is in position to influence it all. Our gut microbiota can influence our thought process related to eating behavior. As you may see in this picture, gut microbiota influence homeostatic regulation as well as non-homeostatic regulation of food choice and food intake. Tryptophan, endocannabinoids, lipopolysaccharides, short-chain fatty acids are secreted by gut microbiota responsible for this control. Further, gut microbiota has individual and population variation. So, now we have discussed one end of this story. In prescribing diet, food preference and food acceptance. The other end is healthy food. What is healthy food and what is the healthy food and what we going to prescribe under this tag? Is there any superfood for healthy category or any healthy food pattern? So let us see. So we are familiar with these words and dietary patterns. Low carb diet, high protein diet, hypocaloric diet, low glycemic index diet, high MUFA diet, keto diet, vegetarian diet, etc. So they gain popularity among people time to time. So are these diets considered to be healthy and will these diet work for us? Let us see. So in 2019-2020, a large study was done among 1,002 participants, including identical twins, and unrelated healthy adults in the United Kingdom. This study was named PREDICT-1 trial or PREDICT-1 study, and they assessed participants' postprandial metabolic response in a clinical setting and at a home after meal. Let's see what are the results. The finding shows wide variation in postprandial response between people, even identical twins, to the same meal. They found that people who experience poor metabolic response to a given meal are likely to respond poorly to the other meal with the same macronutrient profile. Measured by the population coefficient of variation in postprandial response of blood following uh, identical meal, it was found that inter-individual variability is 103% for the triglyceride, 68% for the glucose, even 59% for the insulin. The overall correlation between postprandial glucose and triglyceride response is weak. Person-specific factors such as gut microbiome had a greater influence than did meal macronutrient for postprandial lipemia, but not for postprandial glycemia. Genetic variant had a modest impact on prediction. So what we understand from this research is a meal or meal pattern which we define as healthy for a person may not be healthy as such for another. So, because of these newest research findings, we understand that even when we want to achieve a better metabolic response to a specific food or food pattern, we might not achieve it because of these individual and population variability. Next, let us see whether we can find a superior healthy food or food pattern for a better weight management. This umbrella review, large umbrella review, systemic review was done in 2021 in weight management diet for diabetes. They evaluated dietary approaches for weight loss and remission in people with type 2 diabetes to inform practice and clinical guidelines. So, according to the result of this umbrella review, the main finding which we are interested in discussing today is they have found that there is no particular macronutrient profile or style offer advantage over other for weight management. So in summary, we can understand that there is no perfect macronutrient composition neither to lose weight nor to achieve a good metabolic response which is common to all. There are genetic and epigenetic factors common into play in additional to personal variation and population variations. Our gut microbes can influence of food psychology. So rather than going after world trends, it is wise to look into each and every individual's life. Their wanting, liking, preference, acceptance, availability, and their body response to food have to take into consideration. Copying and pasting a diet will not get our nation healthy. We may need wider discussion and research in particularly our body, our food, and our food culture. So after that, we can think healthy food. Thank you very much.